Let's start. And that's amazing that you are very not only passionate, but it seems you chose a career that you love so much that you're willing to go the extra mile, regardless of the circumstances. And you were speaking about amputation. I'm pretty sure in your field,
Mhm.
this could be traumatic as well. How do you deal with? And I know you enjoy it. You're doing it out of good deed, but how do you cope with some of the traumas in the medical area? Because a lot of doctors that don't speak about this, and you have to be very brave to also be vulnerable, right?
I would say when I was in private practice in New York, I remember telling one of my patients, listen, let me get my workout in to be calm. Because most times doctors in the hospital, they come at a time, it doesn't work. You're at work, you're rushing off, especially if it's a family member. Oh my God, I gotta leave work. I said, let me finish work. Let me go to the gym. And they laugh. I said, I need my Zumba. It relaxes me. I will come in workout clothes where people sit and talk. I went to I'm not naming any hospitals, we won't do that, but I will say that I came in and the patient looked at me and I said, because I could see the nurse was in there and she didn't look happy. And she said, your doctor is not coming at this time. It's 7:45, almost 8 o'clock, blah, blah, blah. And the nurse, visiting hours were over at, I don't know, let's say 8:30. And I just sat there like this because she didn't recognize it. I said, she looked back, she said, yes, may I help you? I said, I'm Dr. DeCoteau, and I actually am here. And since I am not, hired by the hospital, I have privileges, and I know what I said to my patient, I keep my word. My patient looked and the family was in tears laughing because they said your face was looking at her like you wanted to knock her out. Because I meant it. Something like that is a big deal because now the patient's family has trust and the patient's a lot more comfortable. I came, they know I like coffee. One of the family members brought me coffee. I'm a cheap date. I love coffee. Everyone knows this. I had my coffee, I was happy, and we're relaxed now over something that's painful, that's something that's going to change their life, and we can sit down and make an informative decision. I'm giving you medical facts. I'm giving you all the possibilities. I'm giving you the possibilities to go well, things that may not go well. So you're informed to sign that consent. I'm a visual person. I do pictures and they laugh. I said, don't make fun of my little drawings. We're going to draw. But to understand now, with technology, I tell people, look it up. There's so many things, and if you can handle it, there's so many things about that. And get a second opinion. A doctor's only as good as their second opinion. I know what I know, and I also know what I don't know. So go see it. If you get somebody who can tell you something even better, go for it. If you come back and say, Doc, you were right, let's go for it, thank you. And that's how relationships are formed, particularly over something traumatic like an amputation.
Yeah, and as you're talking about this through your role as a doctor and also as a public policy advocate, communication is essential. And so let me ask you, what are the biggest challenges about the communication part on both of these spectrums of your daily responsibilities? Because you know how to handle very well, and I love the fact that you bring dignity to the patient, and I think that's the whole point. Let's make you're not a business. You are a human being that I care because you're under my care, and you provide that dignity to the patient. In a corporate setting, I'm pretty sure it's a little bit more challenging because it's black and white and not so much in the gray area. How what are the opportunities in that aspect of communication?
I think that you having medical professionals going into health equity, which is my pivot that I'm trying to do. Everybody pivots, I think, at a certain point is essential to make sure that you are, I would say, the voice between the bottom line and what the patient needs. There has to be something in the middle. Businesses need to make money. It just is what it is. But at the same time, patients need to be treated with care, dignity. We have to make sure that vulnerable communities are being addressed. I'm big about seniors. It doesn't matter color, race, ethnicity. Seniors, they're a big part of the community who are on medications, who are having procedures, and we have seniors who are fabulous. You're like, what age are you? And then seniors who need a little bit more intervention. That's a vulnerable community. What about for mothers with babies, making sure that children are being fed, that mothers are on the right medication, they're doing their follow-ups to have people thrive? What does that look like? What about incentive programs that many companies have? Oh, if you meet these measures, which again are HEDIS measures, then we give you this. Sometimes people even know about that. There's insurances for seniors that give you free access to the gym. I'm like, oh, I want to be a senior. We all go into the gym. But if you don't translate out the things that sometimes the good things that companies are doing, which sometimes we don't hear about as well, then it gets lost in the sauce and it's us versus them, which doesn't need to be. It needs to be us collectively.
And you spoke about preventive medicine, correct?
Correct.
It's almost like if you don't want to fall into the statistics of being unhealthy,
Mhm.
preventive medicine. As a podiatrist, what are the measurements to be preventive to have good health on your foot?
I say that if you're not a diabetic, you should be seen by your podiatrist at least once a year. I mean, let somebody check your feet that knows feet and ankles. It's not just, oh, my foot. It's depending on the state where your scope of practice is. But let them check it out. You may think that a lot of times we think we know something and then we're like, oh, that's not it. And the doctor's like, no. And I keep telling patients, stop being a WebMD doctor. Those are great to give you tips to take you to the doctor to say this is something that you should check out. And I tell patients all the time, I'd rather laugh than cry. So we're going to check your circulation. We're going to check your skin to see if there's any changes of the skin, skin in terms of infection, in terms of even skin cancers. We're going to check for deformities. Just because you had a crooked toe and grandma had a crooked toe, if your crooked toe is hurting you, let's address it. And if it's bothering the shoe, let's address it. We're going to check for sensation, neuropathy. A lot of patients and particularly diabetics, have problems with sensation. Patients who've had chemotherapy, like myself, problems with sensation, sometimes during and even after the treatment. But I think that it's a good thing to be checked and have a baseline and have an established relationship with your podiatrist where you can say, this doesn't look right. I can go to Dr. So-and-so and he or she is going to make sure my foot is okay. Or you know what? I became hypertensive. What do I need to look for now on my feet? Is swelling, is that something I should be nervous about? Because doctor, I'm swelling these days and I was just diagnosed with hypertension. Or I'm pregnant, my feet hurt. What can I do and cannot do while I'm pregnant? That's a whole nother ballgame as well. And hey, doc, don't have any medical problems, but I like to work out. These my feet hurt, or are these sneakers okay? Those are the things that you're seeing your podiatrist for.
Oh, yeah, we're gonna go into a little bit on the shoe market and
All
understand
right.
what is appropriate. But before I do that, you
Mhm.
spoke about resource allocation, and I believe that the communication on resource allocation is not so clear for I would say the patient, right? The people, the community. And it's very hard because in order to understand some policies, you would need an attorney to read all the little bullet points and all of this. What can and I know doctors do everything they can to communicate to the patient what is out there, but they obviously they don't know everything. What could be done better for the community to understand about the resource allocation for them that's available, like you said, free gym